Hi, how's it going?
How about you?
Good to see you again. So today is your fifth visit here, I guess, your fifth appointment. Today's appointment is just to check over how things are coming along. I think 2 weeks ago you were at Dr. Lion Hamburg's office for a root canal.
Yep.
Yeah. And how did it go?
Pretty good. Went by really quick.
Yeah.
Fairly painful. It was really good.
How long was the appointment for?
Half hour.
Wow, he's done a good job.
Yeah.
That's a molar of a tooth, and he did it from half of it. But you know, he's a professional, and they're all equipped just to do things right. Like the odd time, we used to do root canals, or I used to do them, and it took me 2 hours.
Yeah.
So that's why it's best to get specialists involved in these type of situations, especially with the abscess that you had.
Yeah.
So that's good. Well, I mean, you're here today to examine how the root canal went, and now. Looking at your sore there, I can still see it's indented in. Is it healing pretty good?
Yeah, it's not busting out of me.
Oh, good. So how long did it take for the pus to stop coming out?
By the end of the week.
By the end of the week? So that's good. And it hasn't pus anymore since. So there's a clear sign that it's healed. Because he's been draining pus there for a long time. You can see the scar that's been created. Hopefully the scar will improve itself a little bit. I'm not sure if it will. But I took an x-ray already. And here are the x-rays of the root canal. Now this was the x-ray before the root canal was done, and we had used a gutta-perca to track where the drainage was coming out. It was coming out of this particular root. I'll just open up this here. So that was tracking this abscess which was draining out of your jaw. So you can see all this infection and disease on this x-ray. So if I minimize that, and this is today's x-ray, this is what a root canal looks like. Basically the nerve, the infected material that on the tooth, in the tooth, that was creating this abscess has been cleaned out. Once we clean it out, we generally seal it with an inert substance and something that's opaque so that we can see how that we've done the proper job. We've gone right to the end of the root. So you can see this one's to the end, that one's to the end. This one doesn't look like to the end, but it is, because this root probably shaped in a different direction. So the end of the root is probably there. So did an excellent job, and he always does. That's why I sent you to the best, and that's why the infection stopped draining. So very pleased with that, and that means that we will progress as accordingly. We did your bridge preparation 2 weeks ago, and we had to wait until this heals properly so that we know we weren't going to change the treatment in any way. So I think in 2 weeks, that's going to be your last visit. In 2 weeks, we're going to remove your temporary bridge, put in a permanent bridge, and that'll be it. And then, generally I recommend a follow-up every so often, but and we should have a follow-up for you.
Yeah.
So, but yeah. Do you have any comments there?
No, it's looking pretty good.
Looks pretty good, eh? Yeah, I'm very pleased with it. Everything's turning out very well. You're an excellent patient, and it's working out very well. So we're gonna do that final visit in 2 weeks, and then we're gonna look really good. A lot of good before and after shots.
Oh yeah.
All right. Thanks again.
Thank you.